Ontario Premier Doug Ford has announced plans to significantly expand the use of private providers to perform public health services in a bid to deal with backlogs and delays in the healthcare system. In response, Prime Minister Trudeau has said he will continue to watch that the Canada Health Act is respected. But Canadian provinces have in fact had private healthcare to some degree for many years, in some cases decades. Is it time to have an honest conversation about the reality of non-government healthcare in Canada and the role it can play and perhaps needs to play? Here today to discuss this topic are two experts. Joanna Baron is the Executive Director of the Canadian Constitution Foundation, the same charity that I work for, and Shawn Whatley is a physician, former president of the Ontario Medical Association, and senior fellow with the MacDonald-Laurier Institute. Thank you both so much for joining me today. Dr. Whatley, what exactly is the status of private healthcare in Canada right now?
Well, you mentioned Doug Ford's announcement of expanding services outside of the hospital envelope into quote unquote private facilities. Well, actually, those facilities have existed for decades, as you mentioned in your introduction. He's expanding publicly funded services. So you're not going to pay with your credit card, you're going to pay with your OHIP card. The tricky part in this comes into a definition of what do we mean by private? And so you've seen the leader of the federal NDP, Mr. Jagmeet Singh, say that this is, we're going into free market medicine, it's American medicine, and all sorts of hyperbole around this. Listeners need to know that this is simply an expansion of publicly funded services outside of the hospital environment. Your larger question about private facilities begs a definition of what we mean by that, and I'm happy to unpack it if you want.
Yeah, why don't you expand on that? What exactly does that mean?
Well, when we think of fully public, we think of the post office. They own, run, operate, staff, they do everything with it. At the far extreme of private, you have someone who determines the price, service, volume, quantity, management of that service, and ownership of the facilities that provide that service. Healthcare exists somewhere in the middle of that, I would argue closer to the post office example. The far end of the other end of the spectrum would be a lemonade stand. In Canada, we do have a few fully private imaging clinics. So the Canadian Agency for Drugs, Technology and Health just put out a report just this month, and then another report actually in December that listed 56 facilities in Canada that provide private MRI and CT services. Just by way of comparison, in Canada, we have 549 CT units. So it's about 26% of the services provided. So it's a tiny fraction, but we need to actually sort of separate executive health clinics, WSIB clinics, private imaging clinics. These are all considered private in the sense that you're not getting into those with tax dollars.
Joanna, is there anything you want to add to that and to the role that public or private healthcare has already been playing in our system for years?
Yes. So, for example, we know that in British Columbia, private clinics, fully private clinics existed since I think the 80s or mid 80s with Little Instant. And then the BC government, BC NDP government, although could have been any government, decided to crack down on them. And there was no sort of demonstrated deleterious effects on the public care system. And then later on, even though there was this crackdown, the BC Health Minister, Adrian Dix, ended up leaning on these private clinics, which had developed in the middle of the COVID pandemic to help reduce backlogs. So for me, the other question, which I'm sure Shawn will be more of an expert on than I am, is how do we ensure that a market for these types of clinics continues to exist in an environment where the government makes it extremely cumbersome and uneconomic in many circumstances? Of course, MRI clinics are a sort of exception for even these types of clinics to seem like viable investments. Clearly, to start up a surgical clinic requires a huge capital investment. And if you're in an environment like Canada, where it's uneconomic and where there's a lot of, very harsh regulations, which I'm sure we'll get into, the question is, why would anybody decide to build a business like that?
Well, the hope, I guess, is that with some of these changes, with Ontario looking to expand that, perhaps more people will have an incentive to build that type of business, have that type of entrepreneurship, and address some of these backlogs, the backlogs which have grown significantly throughout the pandemic.